On this morning's Health Watch, part 2 of our series Heart Watch. And here's an alarming statistic. Every year, over 400,000 women have a heart attack. 42% of them die within 1 year compared to 24% of men. That's why this is so important to talk about with our Dr. Jennifer Ashton. She has the top 3 heart tests that all of us women should know about. Good morning.
Good morning, Maggie.
So let's get right to it. Number 1.
Stress echocardiogram. This is a stress test with the benefit of an ultrasound that looks at how the heart functions, thought to be more accurate, especially for women, than the conventional stress test, which just uses an EKG to tell us about the heart.
And the next one is a vascular ultrasound. What is that?
Right. This is an ultrasound that looks at the main artery in the neck, the carotid artery, looks at how thick it is. That thickness is thought to be correlated with increased risk of heart disease.
And the last one is a CT scan.
Now, this is actually exciting. This looks at the calcium in the coronary arteries, and I think we have a graphic of it. Calcium is in these arteries is correlated with increased risk. It's there highlighted by the red arrows. It shows up as white. So increased risk in the coronary arteries, increased risk of heart disease. This does contain radiation, and again, all these tests are not for women unless they have symptoms.
Symptoms of what? Symptoms like
Symptoms
what?
of heart disease or at high risk. The key here is to identify patients who are at intermediate risk, because the high-risk patients will be screened anyway. 90% of physicians, Maggie, do not realize that heart disease is the #1 killer of women. We all need to be concerned about this.
Do you have all 3 tests or just one, but your doctor will choose which is the best?
It depends on your cardiologist, but you're going to be seeing more about these imaging tests. This is very important for all women to know about.
Dr. Jennifer Ashton, thank you.
You bet.